Rookie ER nurse performed emergency surgery alone. Then the Navy helicopter landed. That sounds like the kind of story people call impossible until they find themselves in a room where the blood will not stop. The surgeon is nowhere in sight, and one quiet stranger is the only thing standing between life and death. In a small coastal hospital in Washington on a storm-soaked night that began like any other shift, every monitor, every shouted order, every second became a test of who breaks first under pressure. But this story is more than a medical emergency. It is about hidden experience, battlefield instincts, and the kind of courage that does not ask to be seen. Stay with me to the end, then tell me in the comments where you're watching from and whether you think you could have kept your hands steady in that room. 6 hours earlier, the room still belonged to routine. Midnight settled over Peninsula Memorial Hospital, with the slow certainty of rain moving across dark water. Outside Port Angeles lay half hidden beneath a wet Pacific fog, the harbor lights blurred into soft halos, the ferry dock quiet except for the occasional groan of steel and rope. The storm had not fully arrived yet, but its presence hung in the air. The kind of cold that slipped under doors. The kind of wind that made people look twice at the sky before heading to their cars. Inside the emergency department, the world was all fluorescent light-polished tile in controlled fatigue. Monitors glowed in patient bays. A printer rattled at the nurse's station, spitting out labels with the indifference of a machine that had seen too many names to care about another. A television mounted in the waiting room played a muted, late-night weather segment no one was watching. Coffee sat in paper cups gone lukewarm and bitter. Someone had left a half-eaten granola bar beside a stack of charts. Someone else had forgotten a jacket on the back of a chair. This was how night shift looked in a small coastal hospital that lived between routine and crisis. Not dramatic, not glamorous. Just a place where people came apart quietly. Avery Bennett moved through the department like she had been there much longer than 3 weeks. She wore navy scrubs, no jewelry, no polished charm, no little rituals designed to make a workplace feel like home. Her dark hair was pulled back tight, her badge clipped high and straight. Her expression rested in that neutral place that could read as calm or distance depending on who was looking at her. She did not chatter at the nurse's station. She did not fill silence because silence unsettled other people. She did her work, and she did it with the kind of precision that made ordinary actions look intentional. At bed 4, she adjusted the angle of an oxygen mask on an elderly man with pneumonia and listened to his lungs for a beat longer than expected. "Take a deeper breath for me, Mr. Calloway." The old man tried and winced. "That enough? It is for now." She reached up and lowered the head of the bed by 2 inches. He frowned. "Why's that better?" "Because your shoulders were working harder than your lungs." He blinked at her, then gave a tired nod. "You always this cheerful?" Avery made a note in the chart. Only after midnight. Across the hall, Denise Walker caught the tail end of it and snorted into her coffee. Denise had been charge nurse at Peninsula Memorial for 8 years, and looked like she had earned every single one of them. Blonde hair pinned up in practical defiance, reading glasses hanging by a cord she only wore when charting posture so permanently upright that people unconsciously straightened when she entered a room. She knew which patients would become trouble before triage finished taking vitals. She knew which doctors worked faster when spoken to gently, and which ones needed a hard edge. She ran the department with the efficient warmth of someone who cared deeply and preferred not to advertise it. She watched Avery tuck the stethoscope away and move toward the supply room. "She's weird," Denise said quietly. Dr. Hannah Price stood beside the station reviewing imaging on a tablet. "That your clinical assessment?" Denise did not look away from Avery. "That's my human assessment." Dr. Price let out the smallest hint of a laugh. Hannah Price was the attending on overnight duty, early 40s sharp, featured spare with words and very nearly impossible to impress. She had trained in Seattle, worked in county trauma for years, and come north for a life that promised fewer headlines and slightly more sleep. The life had lied to her on both counts, but she stayed anyway. She trusted protocol, respected competence, and had little patience for ego, which meant she got along with Avery better than most. New nurses are allowed to be strange, Hannah said. New nurses are allowed to be nervous, Denise replied. This one doesn't get nervous. That's the strange part. Avery returned from the supply room with a restocked airway tray and set it down at the exact moment a respiratory therapist appeared asking for it. The therapist stopped short. How did you know I was coming for that? Avery glanced at the empty slot on his cart. Because you already took the other one. Then she walked away before the compliment could find her. Denise tipped her head. See? Hannah looked up from the chart long enough to watch Avery move down the hall, then back to the screen in her hand. Disciplined. No, Denise said. Disciplined is a resident who color codes her trauma notes. Bennett moves like she's waiting for something bad to happen. In Bay 7, a fisherman with a deep laceration across his palm was arguing with a younger nurse about whether he really needed stitches. It's just a cut, he insisted. I've had worse on the boat. Avery stepped in, took one look at the wound, and pulled a chair over. You have had worse, she said. That doesn't make this one smarter. The fisherman stared at her, caught between annoyance and reluctant respect. She set his hand gently onto a sterile drape. Tell me if your fingers go numb. He swallowed. You from around here? Number. Figured. Locals don't sound that calm when they're telling me I'm an idiot. Avery cleaned the wound in silence for a few seconds. I didn't say you were an idiot. He squinted. You thought it. For the first time that night, the corner of her mouth shifted. Barely. Not a smile exactly, but enough to make the room feel less cold. The department eased through its first hour the way small hospitals usually did. Not with stillness, but with managed motion. A teenager came in with a twisted ankle from slipping on wet concrete outside a diner. A child with a barking cough sat in his mother's lap under a dinosaur blanket. A tourist with food poisoning swore the oysters had looked fine. 2 deputies brought in a man who had decided a motel hallway was an acceptable place to lose a fight with a bottle of bourbon. Every patient brought his own little weather system. Fear, irritation, embarrassment, pain, relief. Avery moved through all of it without absorbing any of it into herself. She anticipated. That was what people noticed first. Not speed, not drama, not the kind of flashy competence some new hires used to prove they belonged. Avery worked as though half her job happened 30 seconds ahead of everyone else's. She set out supplies before orders were spoken. She opened tubing, drew medications, reset monitors, cleared physical space in treatment rooms without being asked. When Hannah reached for something, it had already shifted closer to hand. When a patient changed color, Avery was already looking. When a family member rose from a chair with panic in their face, Avery had already turned toward them. At 1 a.m, a middle-aged woman being evaluated for dizziness sat upright too quickly and grabbed the side rail as the room tipped under her. The pulse oximeter still showed a decent number. The blood pressure cuff had not yet recycled. Avery looked up from across the room. She crossed to the bedside, one hand steadying the woman's shoulder. Do not stand. The patient blinked. I was only trying to get to the bathroom. Avery did not answer. She pressed 2 fingers lightly to the woman's wrist, then looked at her face, not the monitor. Hannah, she called. Dr. Price was still charting at the station. What is it? Pressure is dropping. The cuff cycled 3 seconds later and confirmed it. The younger nurse assigned to the room looked startled. How did you know that before the machine? Avery adjusted the patient's legs onto the bed. Because she told us. The nurse frowned at the monitor. She didn't say anything. Avery secured the blanket around the woman's knees and stepped aside for Hannah. She didn't have to. That answer stayed with the nurse longer than she admitted. So did the way Avery's eyes moved. Not restless, not distracted. Scanning. Doorways. Hands. IV lines. Monitor cords. The angle of a patient trying not to show pain. The way a spouse held a purse too tightly. The wheeze beneath a sentence. The pause before nausea. the tiny slackness around the eyes when shock began to pull blood inward and away from expression. She saw the room like a system. Inputs, failures, weak points, pressure shifts. Even when nothing was wrong, she behaved as if things could become wrong at any second. At the nurse's station, Denise signed off on a medication order and lowered her voice. "You know what she reminds me of." Hannah kept reading. "You're going to tell me anyway." Reservist? That made Hannah look up. Denise shrugged. Or military spouse. Or former medic. Something. "What makes you say that?" Denise angled her chin toward Avery, who was reorganizing a procedural tray another nurse had stalked out of sequence. That. Hannah watched for a moment. The instruments were not being arranged the way Peninsula Memorial usually arranged them. Avery was grouping them by immediacy. First touch, second touch. Right hand reach. Sterile line of sight. The order made no sense if you were stalking for inspection. It made perfect sense if you were stalking for use under pressure. She could just be meticulous, Hannah said. Meticulous people announce it. They want credit for noticing. She doesn't. Hannah set the tablet down. "Did you read her file?" "Of course, I read her file." "And?" Denise made a face. "It reads like someone edited all the interesting parts out." Avery had arrived with excellent references and almost no personal history attached to them. A trauma center outside San Diego. Then a travel assignment in Alaska. Then a gap that was explained but not really explained. Every credential current. Every skill signed off. No disciplinary issues. No red flags. No social media trail Denise could find, which in itself felt suspicious in a world where everyone left some version of themselves lying around online. There was competence in the paperwork. There was no story in it. At 1:12, Hannah was suturing the fisherman's hand, while Avery stood at her shoulder managing instruments and irrigation with a seamless rhythm that made conversation feel unnecessary. The fisherman, who had spent the first 10 minutes insisting he did not need a doctor, now sat quietly while Hannah closed the wound. "You married?" he asked Avery out of nowhere. Hannah glanced up, mildly offended on Avery's behalf. Avery did not blink. "No." "Boyfriend, number." The fisherman nodded toward the suture tray. "You got that look." Hannah tied off a stitch. "What look is that?" He thought about it. "Like people either leave you alone or regret not listening." Avery placed the next instrument into Hannah's palm. "Try not to move your hand." The fisherman grunted. That wasn't a no. When the repair was done, Hannah stripped off her gloves and tossed them into the bin. "Did he just flirt with you during laceration closure?" Avery capped the irrigation bottle. "I think he was warning you." This time Hannah did laugh. It changed nothing about Avery's demeanor, but it adjusted something in the room around her. Staff, who had been holding her at a distance, began to pull her into little exchanges. Nothing deep. Small comments, casual jokes, the social probes people used when deciding whether someone was one of them. A younger nurse named Lily leaned against the counter while waiting for Lab to answer. "So where'd you say you worked before this?" "I didn't." Lily smiled, expecting one back. "Okay, where did you work before this?" "California, Alaska." "Which did you like better?" Avery paused as she signed a medication scan. "Depends on whether I wanted sunlight or silence." Lily laughed. "You always talk like that." "Only when people ask broad questions." Lily opened her mouth, then thought better of it. Somewhere down the hall, a patient monitor alarmed twice and stopped. Avery turned before anyone else listened, then relaxed again. Denise noticed. So did Hannah. It happened later, too. A child began coughing behind a closed curtain, and Avery was already pulling a nebulizer setup before the mother reached the desk. A drunk man in the waiting room shifted from slumped resignation to unpredictable anger, and Avery quietly moved a metal stool out of reach with her foot, while security was still on the way. A diabetic patient's speech changed by a fraction, and Avery asked for glucose before the daughter finished saying, "He gets like this sometimes." Competence was not unusual in an emergency department. Pattern recognition was not unusual. But this felt different. Avery did not only respond well once information reached the surface, She behaved as though she trusted the signals beneath it more than most people trusted the obvious. By 1:25, the storm had thickened over the harbor. Rain struck the ambulance bay doors in bursts. The waiting room had thinned. The child with the cough was sleeping. The tourist with food poisoning had stopped apologizing. The drunk in the hallway had finally agreed that water might not be his enemy after all. Hannah took 30 seconds in the break room to swallow half a protein bar and stare at the weather radar on her phone. Avery came in to refill her coffee from the machine no one admitted tasted burnt, no matter how recently it had been cleaned. "You should take 5 minutes," Hannah said without looking up. Avery poured the coffee and tested the temperature against the side of the cup. "I'm holding." That wasn't a suggestion about your endurance. It was a suggestion about the next 6 hours. Avery leaned one shoulder against the counter. The break room light buzzed overhead. Rain tapped at the dark window in the door. Somewhere outside, an ambulance radio crackled and faded. Hannah glanced up. "Do you ever sit down when it helps?" "That's not what I asked." Avery took a small drink of coffee and set the cup down. Hannah waited. Finally, Avery said, "I sit when the room can afford it." That should have sounded dramatic. In her voice, it sounded practical. Hannah studied her for a long beat. "You've worked trauma?" "Yes." "Big center." Avery's eyes moved to the weather radar on Hannah's phone, then back. "Big enough." "How long?" A pause. "Long enough." Hannah almost pushed further, then stopped herself. Some people lied when you asked direct questions. Some people told the truth in pieces so narrow they could barely be called answers. Avery belonged to the second category, and for reasons Hannah did not understand yet, she found herself respecting it. A rotor sound passed, faintly overhead, then distant but distinct somewhere beyond the rain and cloud cover. Hannah barely registered it. Avery did. Not much, just a shift. Her hand, still resting near the coffee cup, went still for half a second. Her eyes lifted toward the ceiling in that tiny reflex people had when they recognize something not by thought, but by the body. Then the expression disappeared. The hand moved again. The moment closed. Hannah said nothing. When they stepped back into the department, Denise was waiting with a chart in one hand. Chest pain in 6 wants to know how much longer before someone tells him whether he's dying. Hannah took the chart. "Tell him the test results are boring, which is good news." Denise nodded, then looked at Avery. "You mind checking on hallway 2 before I go back in there? He's either going to vomit or propose." Avery picked up gloves from the wall dispenser. "Any preference?" Denise smiled despite herself. "Just keep him from doing both." The small joke traveled. The room loosened around Avery by another inch. It was subtle, but real. Trust in hospitals often announced itself through simple things. People stopped double-checking whether you had completed a task. They handed you the difficult family member. They let you run triage for a moment while they charted. They called your name differently, not to test if you were listening, but because they assumed you already were. The first layer of that shift had begun. At 1:33, Avery walked into hallway 2 and found the patient pale, clammy, and trying very hard to remain dignified in a paper gown. "I'm not going to throw up," he said immediately. She held out an emesis bag. "You're going to throw up." He took the bag, maybe. "Your honesty is improving." He gave her a weak smile, then looked toward the station. "You all seem very calm." Avery checked his pulse. "Would you rather we weren't?" He thought about that. No. She adjusted his blanket and moved the rail up. "That's the idea." The overhead speaker clicked with a routine page for respiratory therapy. A printer chirped. The weather report updated across a muted television all wind bands and coastal advisories. Denise walked past with a clipboard. Lily laughed at something a text said and immediately hushed herself because Bay 3 was finally asleep. Someone opened a package of saline flushes at the desk. For one ordinary minute, the emergency department settled into one of those deceptive pockets of calm that made midnight feel survivable. Then Avery stopped at the medication room door and looked toward the ambulance entrance. No sirens yet. No page. Just instinct. Hannah, halfway through reviewing the chest pain patient's EKG, noticed the stillness. "What is it?" she asked. Avery did not answer right away. She was listening, not with her ears alone, with posture, with attention, with that strange way she had of reading the shape of a room before the room itself caught up. Finally, she said nothing yet. Denise, passing behind Hannah, lifted an eyebrow. "That sounds reassuring." Avery turned back to the medication cart and resumed scanning. The moment passed, or seemed to. At 1:39, a call came in from County Dispatch. Denise grabbed the line, listened, and her face changed. The shift around the nurse's station sharpened instantly. Hannah was already moving before Denise covered the mouthpiece and said, "Inbound trauma from Harbor Rescue. Male patient, severe maritime injury. Unstable, 6 minutes out." The room that had spent the last 2 hours operating on practiced reflex slid all at once into something narrower and harder. Avery was already reaching for the major trauma cart. The call moved through the department like a current through water, invisible for a split second, and then suddenly everywhere at once. Conversations died in the middle. Chairs scraped back. Denise Walker shifted from charge nurse warmth to pure command, her voice cutting cleanly through the station. "Trauma Bay 2. Blood bank alert. Call radiology and get Harbor Rescue back on the line." A tech ran for the warmer. Another cleared a gurney from the hall. Lily grabbed fresh suction tubing with both hands and nearly dropped one coil before catching herself. The resident on with Dr. Hannah Price straightened so fast he clipped his hip on the counter and muttered something under his breath. Hannah was already pulling gloves from the wall dispenser. "What do we have?" Denise repeated the dispatch summary as she moved. "Male patient. Severe maritime trauma. Harbor deck accident. Unstable pressure. Probable torso injury. 6 minutes. Mechanism. Cable snap. Thrown into rigging." That was enough to darken Hannah's expression. In coastal towns, people did not need much imagination to understand what steel under tension could do to a human body. Fishing docks, cargo lines, winches, cranes, ferry ramps, fuel deck chains. Everything at the harbor was built to hold force until the instant something failed. When it failed without mercy. Hannah strode into Trauma Bay 2, already assessing the room with the exacting eye of someone who knew every missing piece mattered more than any available one. The bay was functional, clean, familiar, and unremarkable in the way small hospital trauma rooms often were. Overhead lights, suction, monitor leads coiled in place, supply drawers lined with the order of habit rather than abundance. Good enough for control, good enough for the first fight, not built for a long war. Avery rolled the trauma cart in beside the bed and opened it. Her movements had changed. Not faster, not frantic, narrower. Everything unnecessary had fallen away from her in the space of 10 seconds. The social softness the room had barely begun to pull from her was gone. The small, dry humor. The willingness to let people wonder. Now there was only work. She checked airway equipment, laid out pressure bags, primed tubing, opened the chest tray, set a central line kit to the side, then crossed to the blood fridge and stopped. Denise saw her hand hover for the briefest instant. How many units left uncrossed? The tech standing there answered without looking up from the log. 4 in-house. That is it. That is it. Avery nodded once and shut the door. No complaint. No visible reaction. But Hannah saw it happen from across the bay and knew exactly what it meant. 4 units in a place like this was enough until it was not. Enough for the ordinary disaster. Not enough for a body that arrived already emptied by steel. Rain hammered the ambulance entrance. The overhead lights buzzed faintly. Somewhere in the waiting room, a television weather alert rolled mute across the bottom of the screen. The resident Dr. Nate Holloway tugged on gloves and tried to settle his breathing. He was competent, eager, and young enough that stress still climbed visibly into his throat. "Do we know if air transport is live?" he asked. Denise called over her shoulder. "Weather is marginal." Nate's jaw tightened. Marginal was one of those words hospitals used when nobody wanted to say uncertain out loud. Hannah checked the laryngoscope, then looked at Avery. Second suction. Already done. Avery held up the extra line she had just connected. Tested. Pressure bags. Both ready. Thoracotomy tray. Avery had it open before the question was finished. Nate looked from one woman to the other and felt suddenly as if he had entered the middle of a conversation he had not heard begin. The radio on Denise's shoulder crackled. Harbor Rescue had more. She lifted the speaker toward her mouth. Go. A medic's voice came through in bursts of static and engine noise. Male mid-30s named Logan Pike found on deck after line failure. Blunt impact to left thorax and abdomen, possible crush component decreased. Breath sounds on left initially improved with positioning pressure. 80 over palp. Pulse 136 altered but responsive to pain abdomen. Rigid bruising spreading across flank, likely internal bleed, ETA 3. Hannah exhaled once through her nose. Avery was already changing the layout of the tray. This time Hannah watched closely enough to see it. Avery moved the instruments out of the standard sequence Peninsula Memorial used and into a different logic. Immediate hemorrhage control. Rapid access. Contingencies that only mattered if things deteriorated fast. She placed clamps, drapes, scissors, pressure packs, and vascular supplies in a pattern that assumed the room would compress around one problem and stay there. Nothing about it was random. Nothing about it belonged to a nurse improvising on instinct alone. "Why are you setting the tray like that?" Nate asked before he could stop himself. Avery did not look up. "Because if his belly is filling, we do not need to waste reach." Nate frowned. "We are not doing surgery in the ER." "No," Hannah said sharply, but the word lacked full conviction. Because the truth sat there with them, wet and heavy as the storm against the windows. They were not supposed to do surgery in the emergency room. They were not supposed to make major trauma decisions without ideal backup, without an open operating room, without more blood, without more hands, without enough certainty. Small hospitals were full of things people were not supposed to do until the patient gave them no other version of reality. Denise stepped into the doorway with the cordless phone pinched between shoulder and ear, one hand covering the mouthpiece. OR is still occupied. Ruptured ectopic in process. Hannah closed her eyes for half a beat. How long? No firm answer. That meant too long. Transfer center. Trying to patch through. Avery looked up. Ground time to Seattle is meaningless. Denise stared at her, then gave one quick nod because there was nothing to argue with there. Port Angeles sat beautiful and remote in the daytime, all mountain line and harbor light and open water. At night, in bad weather, beauty translated into distance. Distance into time. Time into loss. The ambulance bay doors opened with a crash of cold wind, and Harbor Rescue came through. The gurney wheels hit the floor hard enough to rattle the side rails. Rainwater ran off the paramedics' jackets and streaked across the tile. Logan Pike lay strapped to the stretcher, skin gone, that drained gray common to major blood loss lips, pale hair plastered with rain and sweat. One side of his body was already darkening under the cutaway remains of a work jacket. His abdomen looked wrong before anyone touched it. Too still in one place, too tight in another, as if the body had decided to protect itself by becoming stone. The lead medic never slowed his report. 34-year-old male, working deck line on a fuel tender. Cable snapped under tension threw him into starboard rigging and steel rail, down for under a minute, confused after. Pressure fell from 96 systolic to 80. Pulse climbing. We started fluids, but he is not holding. Diminished on left, improved with oxygen and position. Belly getting harder, flank bruising spreading. He lost consciousness twice en route. Logan's eyes opened in slits as they transferred him to the trauma bed. He sucked in a breath like it hurt to meet the air. "My brother," he rasped. "We will call him," Denise said automatically. His hand twitched once toward his side and then dropped. Hannah was already at the bedside. "Logan, I am Dr. Price. Can you hear me?" A small movement of the head. "Where does it hurt?" A ghost of a laugh escaped him which turned at once into a cough. "That answer is bad enough," Hannah said. "Good. Stay with me." Avery cut away the remaining clothing with short, decisive movements. Logan's torso came into full view under the trauma lights and the room tightened around what it saw. There was bruising along the left lower chest and across the upper abdomen, broad and deep and ugly, the kind that hinted at force transferred below the skin where no one could see the real damage yet. A patch of swelling extended down his flank. His abdomen was rigid under Hannah's hand, not guarding from fear. Hard from blood and insult. Pressure, Lily read from the monitor. 78/46. Pulse 141, Nate added. Hemoglobin from feel, estimated only. No lab yet. Hannah listened to the left chest, pressed 2 fingers under the ribs, watched his face, then looked at Avery. Ultrasound. It was already in her hand. Hannah took the probe and ran a focused scan across the abdomen. The black pockets bloomed on the screen almost immediately. Free fluid where it did not belong. Nate leaned in. Positive fast. Hannah's voice stayed level. Yes. Logan groaned as another wave of pain rolled through him. His eyes tracked upward, unfocused for a second, then found Avery standing at his right side, securing the second large bore line. Am I dying? It was the kind of question emergency rooms heard in every tone there was. Dramatic. Angry, childlike. Furious, detached. His sounded almost apologetic, as if he hated to make them say it. Avery tightened the tape over the line and looked directly at him. Not while we can still fight for you. It was not a promise. It was a contract. His breathing stuttered. The monitor alarmed. Pressure dropping again. Blood now, Hannah said. Denise hung the first unit while Lily squeezed the pressure bag. Nate drew labs with hands that were trying hard not to shake. The tech clipped on fresh leads, checked oxygen, repositioned the overhead light. The bay filled with that strange emergency silence where everyone was speaking, moving, adjusting, but all the noise seemed to flatten under one shared fact. He was bleeding where they could not reach. Hannah stepped back half a pace and thought through the narrowing options at full speed. Internal hemorrhage. Probably splenic, maybe liver, maybe more. The sort of injury that belonged in a trauma center with a team already scrubbed and a surgeon waiting under brighter lights than these. Not here. Not now. Not in a room with 4 units of uncrossed blood and an operating room tied up down the hall. She looked at Denise. Any word on air? Denise had her phone out again. Dispatch says they are checking available lift with military support because civilian flight is weather delayed. Nate glanced up. Military support. Naval Station can sometimes move coastal criticals if the weather corridor opens. Sometimes. The word landed with the same uselessness as marginal. Logan jerked weakly, one hand fighting the blanket as if trying to climb out of his own body. Avery leaned in and put a firm hand on his sternum, not hard enough to hurt, just enough to anchor. Logan, stay here. My side, he gasped. Feels hot. I know. Call Drew. We will. His eyelids fluttered. Tell him I did not let go on purpose. Avery's face did not change, but something in the room felt that line and absorbed it. Harbor men, deck accidents. Brothers on the same boats. This was not abstract trauma. This was a life with a dock waiting for news and people already forming the worst thought in their heads. Denise pointed at a tech. Find next of kin in his wallet. Call whoever is first. The tech nodded and moved. Hannah repeated the ultrasound slower this time, though she already knew what she would see. More fluid. More consequence. The blood they were giving him was entering a body that had nowhere to keep it. Any sign of pelvic instability, Nate asked. Avery answered before Hannah could. Not enough to explain this much decline. Nate looked at her startled, then back at Logan. He was a good resident. Good enough to notice he had started listening to her voice as readily as he listened to Hannah's. The problem with real emergencies was that hierarchy did not disappear. It revealed itself in a different form. Not title, not salary, not who technically outranked whom. It bent toward whoever understood the moment most clearly. Everyone in the bay could feel that shift beginning even if no one would have named it yet. Another unit went up. The blood bank tech appeared at the door, face tight. "That is all the uncrossed we can release right now unless lab confirms." Denise turned. "Run the type as fast as they can. We are trying. Another hospital word that meant the laws of time had not changed just because people needed them to. Hannah pressed 2 fingers to the bridge of her nose for a second, then made herself stop. Thinking was useful. Visible frustration was not. She walked around the bed and looked once more at the entire picture. Mechanism. Ultrasound. Skin. Breath. Pressure. Timeline. Resources. Weather. Distance. The occupied operating room down the hall might as well have been on another continent. She knew the protocol. Stabilize and transfer. The problem was that protocol assumed there was enough of a patient left by the time transfer arrived. Avery was watching the monitor, but Hannah could feel her attention moving through the room like a second pulse. Measuring. Comparing. Looking for weak points in the chain before they broke. How long since injury? Avery asked the lead medic. Under 40 minutes total. Any improvement at any point. Briefly after fluids, then lost it. Avery nodded as if filing a detail where it would matter later. Nate looked from the monitor to Hannah. "Can we tube him now before he crashes?" Hannah considered it. "If we paralyze and sedate, we may lose the pressure he has left. We lose airway control if he spirals. We lose him sooner if induction drops him through the floor." No one argued because both statements were true. Logan made a low sound in his throat and tried to turn away from the pain. Avery adjusted his shoulder, supported the movement, then checked the line again. She was not soothing him in the usual nurse manner. She was managing him the way someone managed a failing position, preserving function where she could, denying panic a place to root. The phone in Denise's hand rang. She stepped into the hall, answered, listened, then came back with her mouth set. "Civilian bird is grounded south of here." Silence. "Military. Naval aviation can attempt a window if we can hold him. If..." Hannah looked at the monitor again. Pressure now 72 systolic with blood running. How long? No guarantee. They are checking. Hannah swore once softly, and only because the room could bear it. Logan's pressure slipped further. His pulse climbed. His skin had that waxy flatness that made a body look already halfway absent. Nate adjusted the oxygen and looked at the saturation readout as though better numbers there might solve anything. Avery moved to the supply wall. Denise noticed first. "What do you need?" Avery opened a drawer that almost never mattered on a normal night. Vascular access kit. Nate followed her with his eyes. For what? Avery did not answer right away. She set the tray on the counter, opened it, then pulled a second package from a lower shelf, one Hannah recognized after a beat with a sharp flicker of surprise. Not because the hospital used it often, because it almost never did. The aortic balloon occlusion kit sat in Avery's gloved hands with the heavy quiet of something more associated with battlefield medicine and major trauma centers than a place like Peninsula Memorial. Nate actually stared. "We have that." Denise let out a humorless breath. "Apparently. It was stocked after the winter pileup on Highway 101. Hannah said more to herself than anyone else. "We never used it." Avery set the kit beside the bed and checked the contents with clean, economical motions. Catheter. Wire. Sheath. Syringes. Connections. Nothing wasted. Nate looked from the kit to Hannah. "You are not serious." Hannah did not answer because she was still thinking. The room contracted around the possibility. Resuscitative balloon occlusion was not magic. It bought time at a cost. It was invasive, risky, and temporary. It demanded judgment and speed. Used badly, it could injure. Used late, it changed nothing. Used well, it could take a man who was pouring out from the inside and buy the thin, violent margin needed to get him to real surgical control. In theory, it belonged in algorithms and advanced trauma protocols. In practice, it belonged to the people in this room right now or to no one. Avery was not looking at Hannah for approval. She was looking at Logan, then the monitor, then the pressure bag, then back at Hannah with a gaze so steady it barely qualified as a challenge. "His bleed is below the diaphragm," she said quietly. "We do not have an open OR. Ground transport kills him. Blood alone is not holding." Nate shook his head. "In a civilian ER without backup." Avery turned to him. "You have backup. You are looking at it." The words were not sharp. That made them sharper. Denise glanced at Hannah. "Can you do it?" Hannah's eyes stayed on Avery for a moment longer than anyone else in the room understood. "Can you assist it?" she asked. Avery met the question without blinking. Yes. Not boastful, not uncertain, just yes. The answer changed the air in the bay, because it was one thing to have a rare tool on a shelf. Another to realize the quiet nurse everyone thought they were still figuring out had seen this kind of choice before. Logan cried out, then a broken reflex more than a voice, and his body bowed against the bed. The monitor threw another low pressure reading. Lily looked frightened now and tried not to show it. The tech at the door shifted his weight from one foot to the other, waiting for an instruction that would make the room feel less impossible. Hannah stepped to the bedside and placed one palm flat on the mattress, grounding herself in something solid. She measured the patient once more with the ruthless honesty medicine sometimes demanded. No open OR. No immediate civilian air. Minimal blood. Ongoing abdominal hemorrhage. A body slipping away by the second. She thought of the ruptured ectopic in surgery down the hall. Another life under another light, another team fighting its own clock. This was the hidden truth of medicine. People outside hospitals rarely understood. Emergencies did not line up politely and wait their turn. They collided, they stacked, they stole from one another. Denise had already moved closer to the tray. Nate looked at Hannah. "If this goes bad," Hannah answered without turning. "It is already going bad." That shut the room still. Avery picked up a pair of sterile gloves for Hannah and held them open. Hannah slid her hands in. "Denise, keep transfer center hot. Lily, pressure and blood. Nate, ultrasound with me. Tech, clear the room of anything we do not need." Everyone moved. Not because fear had lifted. Because decision once made was easier to serve than uncertainty. Logan's breathing hitched again. His eyes found Avery's face through pain and blur. "Please," he whispered. And whether he meant save me, or do not let me feel this, or call my brother, no one could have said. Avery leaned close, one hand braced at his shoulder. "Listen to me. Stay with my voice." His eyes tried. She nodded once as if that effort alone mattered. "It does," she said. And only then did Nate realize she had answered something Logan had not spoken aloud. The rain intensified against the doors. In the hall, the overhead lights reflected in slick footprints left by harbor rescue. Somewhere beyond the ambulance bay, the black water of the harbor kept heaving under wind and steel, and all the machinery of a working coast. Inside Trauma Bay, too, every instrument now had a purpose, every hand an assignment, every breath a cost. Hannah looked at the kit at Avery, at the patient, and said the words that pulled the whole room across the line. Set up for femoral access. No one in Trauma Bay 2 moved for a heartbeat. Not because they had not heard Dr. Hannah Price, because hearing and believing were two different things, and the order she had just given belonged to a world larger and harder than this one. It did not belong to a modest coastal emergency department in Port Angeles, on a storm-soaked night with one occupied operating room, 4 units of uncrossed blood, and a patient running out of himself by the second. Then Avery Bennett moved, and the room remembered that disbelief was a luxury. She turned toward the lower tray, pulled the sterile drapes free and snapped them open with a practiced flick of the wrists that kept the field clean and the motion quiet. Nate Holloway took the ultrasound machine into position, still wearing the expression of a man trying to keep up with a language he had technically studied, but had never expected to hear spoken this fluently in front of him. Denise Walker checked the bloodline, confirmed pressure flow, and ordered a second phone call to transfer center without ever raising her voice. Lily prepped the groin, wide field. Lily nodded and reached for chlorhexidine. Avery, wire and sheath. Ready. Nate, stay on the vessel. Got it. Logan Pike's breathing had gone shallow and quick, each inhale clipped by pain, each exhale sounding more like surrender than air. His eyes opened only in fragments now, never fully, never for long. When Avery touched his shoulder again, he turned toward her voice with the reflex of someone surfacing through black water. Logan, she said, I need you still. He swallowed but did not answer. His pulse climbed again. Pressure hanging low, blood pushing in, blood disappearing somewhere deeper. Hannah washed the probe over the femoral line target and narrowed her focus until the whole room reduced to vessel angle timing. This was the work beneath the work. No broad heroics, no grand declarations, only anatomy and consequence in the narrow corridor between them. Vessel there, Nate said, watching the screen. I have it. I see it. Avery held the drape edge in place, then laid the wire package into Hannah's palm at the precise second it was needed. Not before, not after. There was no friction to her assistance. No scramble, no correction. She behaved as if Hannah's hands were extensions of a sequence she already knew. The needle went in. For one moment, nothing. Then flash. Access, Hannah said. Avery had the syringe ready. Nate kept the image centered. Denise called out the pressure again from the monitor without being asked. 70/40. Keep the blood moving. Lily tightened the pressure bag until her forearms shook. Hannah advanced the wire eyes on the screen, every nerve in her shoulders visible now beneath control. This was the point where small errors became large ones. Too shallow, and the effort changed nothing. Too clumsy, and the rescue injured the body it meant to buy time for. Too slow, and the patient outran the decision. Avery reached across the sterile field and adjusted the overhead light 2 inches to the left. Hannah did not look up, but she registered the improvement instantly. Thank you. Avery said nothing. The sheath followed. Logan's body stiffened under the pain. A broken sound left him thin and involuntary. Avery leaned close enough that only he could hear her. Stay with me. You are doing what you need to do. He blinked toward her with one eye half open. Hurts. I know. Feels wrong. It is wrong, she said, and there was no softness in the truth, only steadiness. But you are still here. Something in him seemed to settle around that. Not comfort. Permission to endure. Nate looked up from the screen for half a second and then back down. He would remember that later, the way she spoke to pain without pretending to defeat it. Hannah secured the sheath and drew one controlled breath through her nose. Balloon. Avery placed the catheter into Hannah's hand. Every person in the bay watched the movement that followed with the sharpened stillness of people who understood they were no longer working inside routine. The balloon advanced with careful speed. Hannah tracked insertion length, anatomy, resistance. Nate called visual landmarks from the ultrasound screen. Avery held pressure where needed, adjusted lines, shifted the drape edge, and somehow kept half the room organized while never letting her gaze drift far from Logan's face and the monitor beyond it. Lily swallowed. Pressure 68. Denise answered before fear could root. Read it again in 10. It is dropping. I heard you. Hannah did not look up. Inflation on my count. Avery's hand was already on the syringe. Nate's voice was tighter now. Position is there. Hannah stared one last second, trusting her training, the screen, the body, the logic of damage. Now. Avery inflated. It happened with deceptive quiet. No cinematic burst. No miraculous return. No immediate release of tension. Just a pause in the body's collapse so subtle that for a second nobody knew whether anything had changed at all. Then the monitor tone altered. Pressure edged upward. Not much, not enough to make anyone relax, but upward. 74, Lily said, almost not believing her own voice. Now 78. Denise looked from the monitor to Hannah. It is responding. Hannah held the catheter steady, secure it. Avery was already doing it. The room exhaled without permission. That breath did not mean safety. It meant only that death had been forced one step backward. But in trauma medicine, one step was often the difference between a body that arrived and a body that could still be handed over. Logan's head rolled weakly against the mattress. The hard panic in his face eased by a fraction enough to make him look suddenly younger than he had on arrival. Avery checked the securing line, then looked up at the monitor and did what she had been doing from the first second of this case. She recalculated. Current pressure better but fragile. Distal perfusion sacrificed for temporary control. Time bought at a cost. Blood still required. Definite surgery still necessary. Transport now possible, not optional. She turned to Denise. Call transfer center again. Use the exact words. Temporary occlusion in place. Active abdominal hemorrhage. He needs definitive control on arrival. Denise did not even hesitate at taking direction from her. Already on it. That realization reached Nate before anyone else. Something had shifted in the room so cleanly that no one had announced it. Avery was still not the attending. Still not the physician. Still not the formal authority. But the center of gravity had leaned toward her anyway because she spoke as someone who understood not only the procedure itself, but what came after it. What could fail, what could not be delayed. Hannah finally looked up from the field and met Avery's eyes across the bed. A long second passed there. Not gratitude, not surprise, recognition. Hannah had worked with excellent nurses before. Fast nurses, fearless nurses, ICU nurses, who could sense a crash before a monitor could prove it. Avery belonged to none of those categories neatly enough. She was too exact, too economical, too unsurprised by the brutal math of this kind of intervention. She moved like someone whose skill had once been used in places where the walls shook and the protocol had to fit inside a backpack. "Where did you learn this?" Nate asked before anyone could stop him. Avery checked the line sight once more. "I said I had assisted it." "That is not an answer." "No," she said. "It is the one that matters." Nate stared, then looked to Hannah for backup. Hannah only said focus on the patient. That ended it. For the next several minutes, the bay narrowed to maintenance. Blood in. Airway watched. Pressure tracked. Catheter secured. Pain balanced against physiology. Denise coordinated with transfer center blood bank and county dispatch in clipped bursts from the doorway. Lily started to find her footing again now that there was something concrete to do beyond watch numbers fall. The tech swapped out suction canisters and reset the floor around the bed. Nate documented access time and pressure changes while trying to quiet the rush in his ears. Avery never stopped moving. She changed gloves and checked Logan's pupils. She adjusted the oxygen mask when his breathing pattern altered. She rethreaded tubing so nothing would catch during transfer. She confirmed with Hannah twice that the insertion site remained dry and stable. She repositioned the monitor leads because a distorted tracing now would cost clarity later. Each action looked minor by itself. Together they formed the architecture keeping the rescue from unraveling. Logan stirred again and whispered through cracked lips, cold. Avery pulled a warmed blanket higher across his chest. "Of course you are." He looked at her with the dazed suspicion of a man trying to understand whether he was still in the same world he had left on the deck. "Are you a doctor?" "Number?" He breathed once, shallow and careful. "You sound like one." That could have drawn laughter on another night in another room. Here it landed differently. Avery tucked the blanket edge near his collarbone. "You already have one of those. Keep your eyes open." He obeyed her before he obeyed pain. At the doorway, Denise lowered the phone from her ear and spoke directly to Hannah. "Naval transport is reviewing. Civilian flight still weather held. Ground remains non-viable in current status." Hannah stripped off one glove, flexed her fingers, then pulled a fresh pair on. "Reviewing means what?" "It means they want confirmation that he will live to the pad." Hannah gave a short, bitter laugh with no humor in it at all. Generous of them. Denise looked at the monitor. "Can we honestly say that?" Hannah glanced at Avery, then at the balloon line taped against the drape, then back to the pressure readout. "We can honestly say he has a chance. Sometimes that is enough," Avery said. The line drew Hannah's eyes back to her. It was not optimism, it was doctrine. Nate was beginning to sense it too. Not simply that Avery had worked trauma somewhere serious, that she had been shaped inside a culture where medicine and survival had no patience for sentimentality, where chance was not a poor substitute for certainty, but the only currency available. A fresh alarm chirped from the monitor. Saturation slipping. Nate looked up. He is tiring. Hannah checked his chest rise. Less movement now on the left than before. Avery leaned in, listened, then put her stethoscope aside. His left side is worse. Nate shifted to the chest. Could be evolving hemothorax. Could be, Hannah said, though the words carried no comfort. Another problem. Another tax on the time they had just bought. The body had not stopped being injured because they had interrupted one part of the collapse. Hannah considered the chest for one hard second, then reached for the marker. Prep for decompression. If he is collecting, I want control before he spirals. Avery already had the tray open. Nate watched her hand over the thoracic supplies and felt a private disorientation he could not name. She did not appear stressed enough for this room, and that was not because she failed to understand the stakes. It was because she understood them so thoroughly that panic had long ago ceased to be useful to her. Logan moaned when they rolled his shoulder slightly. Avery braced him with forearm and palm firm and clean. "Stay with the breath, Logan." "I cannot." "You can." He shook his head once, barely. She leaned closer, her voice dropping low. Not soothing, not forceful, just impossible to ignore. "Then borrow mine for a minute." For the second time, Nate looked up from his own hands. So did Lily. No one spoke. No one would have known what to say to that. The chest intervention went quickly. Blood and air released enough to improve the mechanics by degree, not miracle. Another margin reclaimed, another edge held. Hannah worked with the severe concentration of someone keeping 6 calculations active at once. Avery followed every turn of her thought almost before it surfaced. Clamp in Avery's hand. Gauze. Already there. More light. Adjusted. Pressure check. 82 systolic. Hannah did not praise her because praise would have broken the rhythm. But she did something more revealing. She stopped checking whether Avery would be where she needed her to be. She simply assumed it. That trust became visible to everyone in the room. Denise came back off the phone with the transfer center and gave the update they had all been waiting for. Naval Air can take him if we are pad ready inside 20 minutes. They want direct physician handoff and current pressure trend. Tell them they are getting it, Hannah said. Denise nodded and turned back toward the hall. Nate let out a breath he had been holding long enough to make his vision pulse. 20 minutes. Avery was already clearing the area around the bed. Then stop looking at the clock. He looked at her, startled. She did not soften it for him. Use the time you have. That landed because it was exactly what he needed and exactly what he hated hearing. He bent back over the line chart and worked. The storm kept pressing itself against the building. Rain hissed across the ambulance doors. Wind dragged something metallic outside with a scraping clatter and then silence. Beyond the walls, Port Angeles remained what it had always been in bad weather, beautiful and inconvenient, and very far from the kinds of resources that would have made this case ordinary. Inside the bay had become something else, no longer a small hospital trying to be enough. A temporary operating environment held together by discipline anatomy and a woman no one had fully understood when the shift began. Denise returned to the bedside with a portable monitor and the transport packet. Flight wants to know what exactly you used. Aortic balloon occlusion for temporary hemorrhage control, Hannah said. Zone 1 placement. Partial pressure response. Ongoing transfusion. Suspected abdominal source from blunt maritime trauma. Denise repeated it into the phone. The word sounded strange in this room, too large for the setting, too advanced for what people outside medicine imagined happened in places like this. Yet there it was, true all the same. Lily adjusted the blood tubing and risked a question toward Avery while Logan drifted at the edge of consciousness. "Have you ever done this before?" Avery looked at the line, not at Lily. Yes. In a hospital like this, a very brief pause. Number. Lily absorbed that. It was not the answer itself. It was the shape of it, honest enough to open a door, closed enough to reveal nothing beyond it. Logan's eyelids flickered again. "My brother," he whispered. Denise, still on the call, covered the receiver. Contact made. Harbor office reached him. "He is coming." Logan took that in with the exhausted seriousness of a man whose whole world had narrowed to a few essential facts. "Good." Avery nodded once. "Good." His fingers twitched near the blanket. She caught his hand and held it only long enough to settle the movement, then let go. Practical touch. No more, no less. Nate finished charting and looked up at Hannah. What if the pressure drops again in transit? Then, flight manages the line and prays the weather lets them stay ahead of it. That is not much of a plan. It is the only one that matches reality. Avery secured another piece of tubing at Logan's shoulder. Reality does not care whether the plan feels complete. Nate gave a tired, humorless smile. "Do you ever say anything comforting?" "Very rarely." For the first time since the trauma call, a few people in the room almost smiled. It helped, not because the case had improved enough to permit relief, because tension that held too long made hands stupid. Avery knew that too. The room had begun to learn the subtle ways she managed not only the patient but the people around him. A clipped sentence here, a precise instruction there, a shard of dry wit introduced only when it would steady rather than distract. That kind of command did not come from textbooks. Hannah checked the insertion site again and finally allowed herself one full breath. "Good hold." Avery met the comment with a brief nod and nothing more. Nate looked between them. "You two have worked together before." "No," Hannah said. "Feels like it." Hannah stripped off another pair of gloves and dropped them in the bin. "It does." Silence settled after that, but not the earlier kind. This silence was built from coordinated work, from things functioning, from a room no longer asking whether action was possible, only how long control could be maintained. The trauma bay door opened, and the blood bank tech appeared again with typed results in hand. Confirmed type. Additional units available in 12 minutes. Denise took the paper. "We may not have 12. The tech looked at the bed at the line at the blood, and then away. "I know." He left without another word. Avery checked Logan's feet beneath the blanket, noted the expected cooling from distal occlusion, then covered them again. She made no comment. She knew exactly what the body was paying for this temporary stability, and she knew that every minute they held it here increased the bill. Hannah saw her do the check. "You are tracking downstream perfusion." "Yes." "Why?" Avery glanced at her. "Because borrowed time still costs time." There it was again, that strange way she had of compressing entire operational logic into one unadorned sentence. Nate heard it too. Later, he would realize that this was what unsettled him most about Avery. She never sounded like someone trying to impress people with knowledge. She sounded like someone stripping information down to the minimum needed to survive it. The call from Transfer Center ended. Denise tucked the phone into her scrub pocket. "Pad team notified. Naval transport finalizing route. We move as soon as they confirm touchdown." Hannah nodded. "Then we package now." And the room changed phase once more. Everything that had been focused inward on procedure shifted toward movement. Portable oxygen. Monitor battery. Additional blood secured for travel. Chart copies clipped. Medication list attached. Insertion details documented. Tubing shortened, looped, taped, protected against jostle. The choreography of transfer began, and Avery moved through it with a fluency so complete it made the rest of them feel half a beat behind. She locked the catheter line with one hand, while asking for extra stabilization pads with the other. She had Nate repeat the access time aloud while she checked it against the chart. She made Lily reroute the monitor cable because it would snag on the gurney rail if left as it was. Lily blinked. "How did you even see that?" Avery did not look up. "Because it will matter when no one has hands free." Lily changed it immediately. Denise handed Hannah the phone again. "Flight surgeon wants direct report." Hannah took it, delivered the summary in the pared-down language of one physician talking to another, and while she spoke her eyes kept drifting back to Avery. The call ended. Hannah returned the phone and finally said the thing she had been holding since the balloon pressure rose. You were right. Avery checked the transport monitor lead, then secured it with fresh tape. Yes. No false modesty. No triumph. Just yes. That answer should have irritated Hannah. Instead, it almost made her smile. Because it was not arrogance. It was the absence of performance. Avery did not need the sentence dressed up into humility to make anyone comfortable. The patient needed what he needed. The room had done what it had to do. Pretending otherwise would have wasted breath. A fresh groan escaped Logan as another wave of pain broke through the medication balance. Hannah checked his responsiveness. Logan, look at me. His eyes dragged open. You are being transferred by air. He looked confused for a second, then frightened. Bad. Serious. He licked dry lips. Am I making it? Hannah could have answered in physician language. Could have said we are doing everything possible, could have buried truth under practiced reassurance. Instead, she found herself answering more like Avery had been answering all night. You are still in the fight. Logan held her gaze, then gave the smallest nod. Avery adjusted the blanket once more. Your brother is on his way. He breathed out through his nose, as if that mattered more than the helicopter, more than the line in his artery, more than any machine in the room. It probably did. The clock kept moving. So did the storm. So did the room. Nate finished the final chart entry and stared at the screen for a moment longer than necessary, feeling the delayed tremor in his own hands now that the worst of the immediate procedure had passed. Avery noticed without turning. Drink water before transport. He almost laughed. Now, yes? He looked at her, then at the nearby sink, then obeyed. Denise caught that and shook her head once in quiet disbelief, not at Nate, at the totality of it. This new nurse, this almost silent woman with the unreadable past, had somehow become the person half the room now moved around instinctively. Not out of social loyalty, out of trust. At the far end of the hall, somewhere beyond the closed doors, surgery was still fighting its own crisis under another set of lights. The rest of the emergency department still existed. The child with the cough, the dizzy woman, the fisherman with the stitched hand, the drunk in hallway 2 who might yet vomit into the bag Avery had predicted. Medicine never stopped being crowded simply because one story grew louder than the others, and yet the gravity of Trauma Bay 2 had pulled everything inward. Avery tightened the final securing strip, checked Logan's line, then stood very still for 1 second with her eyes on the monitor. Not resting. Listening to the room through all its machines and breath and weather and human strain. When she spoke, it was not to Hannah. It was to Denise. Clear the route from bay to pad. No tight turns. Denise nodded. Already told them. Avery looked toward the ambulance entrance where rain pulsed silver against the glass. Good. The overhead speakers remained quiet. No official call yet. No rotor sound. No arrival announced. Only the storm and the low electric hum of a room that had crossed far beyond its normal boundaries and was somehow still holding. Hannah washed her hands again, dried them, and stood at the bedside beside Avery. For a moment, neither woman spoke. They did not need to. Everything useful between them had already been said through Clamp's lines, blood sequence, and time. Finally, Hannah asked quietly enough that only Avery could hear. You did not learn this in California, did you? Avery kept her eyes on the patient. No. In Alaska. Number. Hannah waited. Avery did not elaborate. The silence that followed was not defensive. It was final. Hannah accepted it. The pressure held in the low 80s. Fragile, but real. Blood continued to run. The line remained secure. Logan drifted in and out but came back when called. The transfer packet sat clipped and ready. Outside, the rain had turned harder, driven nearly sideways now by coastal wind. Inside, every person in the bay understood that what had happened in this room would be carried in memory long after the floor was mopped and the cart restocked. Not because they had used rare equipment. Not because the numbers had climbed by a few hard-won points, because they had watched an unassuming nurse step into a failing space and shape it with the confidence of someone who had once done more with less and survived the memory of it. Denise came back to the bedside, listening to the comms line in one ear. Her face changed. Not fear this time. Recognition of a new phase. She lifted her head toward the ceiling as if listening past the fluorescent buzz, past the weather, past the building itself. Then she looked at Hannah. They are close. At first, the sound did not seem to belong to the hospital at all. It entered through the storm as a distant vibration beneath the rain, low and mechanical, almost easy to mistake for thunder rolling off the strait. But thunder did not hold a rhythm. Thunder did not build with intention. This did. A measured blade beat carrying through cloud and water and darkness until the ceiling itself seemed to feel it. Lily looked up first, then Nate, then the tech at the door. The fluorescent lights trembled almost imperceptibly. A clipboard hanging beside the crash cart gave a faint, dry rattle against the wall. Outside the ambulance entrance, the rain changed shape, driven sideways and then in circles as the air over the parking lot began to churn. Denise did not smile, but something in her shoulders unlocked. They found the window. No one answered because the room had already moved from hearing to doing. Hannah checked the insertion site one more time, then the monitor, then the transport packet clipped at the foot of the bed. Logan Pike lay pale and damp beneath warming blankets and tape and tubing held inside the narrowest possible band of survival. The balloon line remained secure. Blood crept through the tubing with grave purpose. Every useful thing in the room had been turned toward preserving what little margin they had bought. Avery lifted the portable monitor from the counter and set it onto the gurney frame. She checked battery life, then the lead positions, then the oxygen connection, then Logan's airway again, her hands never showing haste. The rotor beat outside thickened until it became not just sound but pressure, a force touching the walls, the floor, the bodies of everyone standing in Trauma Bay 2. The windows along the far corridor flickered white. Searchlight. A tech near the station whispered, "That is Navy." It did not sound like excitement. It sounded like the room realizing it had crossed into someone else's world. Rainwater on the glass jumped under the first hard slap of rotor wash. Paperwork at the nurse's station shivered. An empty medication cup rolled across the counter and fell to the floor. Logan stirred weakly eyes, fluttering under the assault of noise and pain. Avery leaned over him, one hand steady at his shoulder. "Stay where you are." He tried to focus on her face. "What is that?" "Your ride." He swallowed with effort. "Sounds expensive." That drew the smallest breath of laughter from Denise gone almost before it formed. Avery checked the line to his mask. "Then make it worth the fuel." The helicopter swept lower. The emergency department changed around it. Not in function, in atmosphere. The ordinary insulation of civilian medicine had thinned. The building still smelled of antiseptic and damp coats and overheated electronics, but now there was the metallic edge of aviation fuel in the air each time the ambulance doors opened down the hall. Wind pressed against the structure like an animal testing a cage. Denise spoke into the comms line clipped at her shoulder. "Peninsula Memorial to landing team. Patient stabilized for transport. Temporary aortic occlusion in place. Pressure holding in the low 80s. You will receive physician report at bedside." Static answered then, a voice from somewhere beneath the rotor thunder. "Copy. Team moving." Avery heard the words and did not react. That was what Hannah noticed. Not calm. Hannah had seen calm before. Nurses who could anchor a room, physicians who could flatten their own pulse under pressure, medics who knew how to step around panic as if it were another piece of equipment. This was something finer, a familiarity so complete it bordered on absence. Avery did not brace herself for military presence entering the department. She adjusted for it the way she adjusted for light-angle tubing-length noise. Just another variable in an already moving equation. Hannah stepped to the head of the bed and checked Logan again. "Logan, can you hear me?" His eyes opened to slits, trying. "You are being transferred to a higher surgical team. Helicopter." "Yes." He breathed in shallowly, then winced. "Never got on one sober." Avery glanced at him. "Good time to start." Again, that almost smile moved through the room and vanished. Nate, standing at the opposite rail with the chart tucked under one arm, felt his own breathing settle around it. Avery did not offer comfort the way most people did. She cut openings in fear just wide enough for people to move through. The doors at the far end of the hall opened with a rush of colder air. Boots on tile. Not running, not hurrying, efficient. A shape crossed the glass panel in the trauma bay door, broad-shouldered and dark against the lights behind him. The door pushed wider, and a man stepped in wearing a soaked combat jacket over flight-appropriate layers, sleeves wet to the forearms, posture straight in the effortless way that came from years of carrying weight and not discussing it. His hair was clipped close. His face had the hard economy of someone used to making decisions under poor conditions and not wasting words after. He did not speak immediately. He took in the room first. Monitor. Blood. Balloon line. Attending physician. Charge nurse. Resident. Then Avery Bennett at the bedside, one hand steady on the patient, while the other adjusted the transport leads with exact, unshowy competence. The man stopped. No one in the room knew him, but every person present felt the authority in the pause. Denise moved to intercept with hospital courtesy and professional caution. "Can I help you?" He held up one gloved hand without looking away from the bed. Gunnery Sergeant Cole Mercer, Naval Air Transport Liaison. His eyes had already returned to Avery, not the casual glance of someone noting another clinician. Recognition was gathering there, deliberate and sharp. Avery secured the final monitor clip and only then turned toward him. For the first time since the helicopter approached, something shifted across her face. Not surprise, not concern, a private recalibration. Mercer took one step closer, stopping just short of the sterile space around the bed. Rain still clung to his jacket collar. The smell of wet canvas and rotor wash entered with him. He looked at the line, the blood, the tape placement, the arrangement of supplies that had transformed the small trauma bay into an improvised, high-acuity control point. Then he looked at Avery's hands. Those hands told him the rest. He lowered his voice, but in the hush that followed it carried anyway. Did not expect to see Atlas in a civilian ER. The room did not freeze all at once. It tightened. A pulse of silence moved through everyone there. Nate looked up so fast he nearly lost his hold on the chart. Lily stared from Mercer to Avery and back again, as if she had just watched two strangers speak a language no one else in the room knew. Denise did not blink. Hannah, who had spent the last hour discovering the outer edge of Avery's clinical competence, felt the center of the mystery she had been circling shift one hard turn closer. Atlas. Not a nickname you earned in break room banter. Not the kind of name people improvised for someone they met last month. A call sign. A history. A world. Avery looked at Mercer for one beat longer than politeness required, then turned back to Logan and checked his pulse ox lead as if nothing had happened. "You are late," she said. Mercer's mouth moved almost toward a smile. Weather. There was no reunion in it. No sentiment. Only recognition between people accustomed to finding each other again in ugly places. Nate found his voice first, though barely. "You know her?" Mercer kept his gaze on Avery another second before answering. "I know what she can do." No one challenged him. Not because the statement was vague, because the room had already watched enough to believe almost any version of it. Hannah stepped into the silence with the practical authority of someone who still had a patient to move. "If you are taking him, I need your flight medic team in here now, and I need a secured route to the pad." Mercer turned to her at once, all business. "Team is 30 seconds behind me. Route is clear. Bird is hot and ready." He glanced back at Logan, then at the balloon line again. "This line holds in transit." Hannah answered, "It holds if no one is careless." Mercer gave one brief nod, understood. He looked at Avery once more. "You placed it." Hannah answered before Avery could. I did. Mercer did not seem embarrassed by the correction, but she saw it first. It was not a question. Hannah held his gaze and found there no challenge, only informed certainty. Yes, she said. Mercer absorbed that without visible reaction. He had expected nothing less. Logan moved weakly under the blanket as the rotor wash deepened outside the sound, now a living force pressing through the building. His eyes drifted toward Mercer, unfocused. Military. Mercer stepped to the bedside and crouched just enough to enter the patient's field of view without blocking anyone's work. "Transport team," he said. "You stay breathing and let us carry the ugly part." Logan gave the smallest breath that might have been a laugh. Avery checked the oxygen flow again. Mercer rose and looked at her with a gaze sharpened not by curiosity but by memory. "You really disappeared." Avery adjusted the tape at Logan's shoulder. "No, I relocated. Same thing if people spend enough time looking." A flicker moved through her eyes. Then maybe they should have spent less. The exchange was so quiet and so clean that it left no room for anyone else to step into it. Nate stood only 2 feet away and understood almost none of it. Yet the emotional shape of it was unmistakable. Shared ground. Old discipline. Things not spoken because speaking them would not improve the patient's odds. The flight medics entered on Mercer's heels carrying compact transport packs and the wind of the landing pad with them. One woman, lean and focused, crossed straight to Hannah for report. Another moved to the foot of the bed and began assessing line security with the brisk care of someone who knew exactly how much trouble one loose connection could cause in the air. Hannah delivered the report in the clipped language serious medicine preferred. Logan Pike, 34. Blunt maritime trauma. Likely abdominal source positive. Fast. Profound hypotension, unresponsive to fluid alone, temporary zone. 1. Occlusion in place left chest decompressed active transfusion pressure now 84/50 on support. The lead flight medic listened with one hand already tracing the transport sequence. "Time of occlusion," Nate answered from the chart. "Complications. None during access. Ongoing high risk of hemodynamic collapse if line shifts or bleed worsens." The medic nodded. "Receiving facility is ready." Mercer remained near the head of the bed, watchful without intruding. Every now and then his gaze returned to Avery, reading details the rest of them could not read. The way she had looped the tubing. The way she stood with one foot set to brace if the bed jolted. The way she watched not only the patient and the line, but the people moving around him adjusting for their blind spots before they created one. He had seen that before. In triage tents under floodlights. In aid stations with dirt in the corners and engines running outside. In field rooms where medicine happened because stopping was not on offer. Denise caught him watching. "What does Atlas mean?" Mercer turned to her, and for the first time there was a hint of caution in his face. Not refusal. Calculation. How much could be said in a civilian trauma room with a patient still unstable and a rotor still hammering the roofline? "It means she carried weight," he said at last. Denise, who had no patience for elegant evasions, folded her arms. "That sounds poetic." I asked what it means. Mercer looked at Avery. Avery did not look back. "It means people talked too much." Something about the dryness of the answer relieved pressure in the room without resolving anything. Denise almost smiled despite herself, but it faded quickly. The question had not gone away. It had simply deepened. The second flight medic checked the bloodline, then glanced toward Avery. "You the one who packaged this?" Avery answered yes. The medic nodded once. Professional approval. "Good work." Avery gave him nothing but a brief glance and returned to Logan's monitor. Praise slid off her as efficiently as panic. The trauma bay door opened again. This time, the man who stepped in did not bring the storm with him. He brought the opposite. A stillness so deliberate it seemed to push back against the noise. Dark overcoat, clean collar, no visible insignia. Mid-50s perhaps, though the face gave little away beyond controlled intelligence and the sort of restraint money or government often taught badly, and this man had clearly learned well. Denise took one look at him and straightened. He crossed the threshold without hesitation, but stopped before the bedside, respecting the work already happening there. His eyes moved over the room with trained efficiency and settled on Avery. Not on Hannah, the attending physician. Not on Mercer. On Avery. That fact landed on everyone present with more force than the helicopter had. Mercer shifted half a step aside. Not deference exactly. Familiarity with the chain of command that existed whether civilians understood it or not. The man inclined his head. Ms. Bennett. Avery did not turn right away. She finished checking the transport monitor battery, then looked up. Mr. Reed. Denise heard that and felt the quietest jolt. No question in Avery's voice. No confusion. She knew him. Mr. Reed took one more step forward, keeping his tone low and formal. Thank you for your continued service. No one moved. No one breathed more loudly than necessary. The line itself was simple, measured. It did not explain anything. It did not need to. The weight of it came from the fact that it was delivered in a hospital trauma bay by a man who looked as though official doors opened before he reached for them. Continued service. Not previous service. Not former service. Continued. Nate stared at Avery as if seeing her for the first time, and not liking how incomplete that first look had been. Lily's eyes widened, and then dropped immediately back to the blood tubing because instinct told her some moments should not be stared at too directly. Hannah remained still beside the bed, one hand resting on the rail. She had spent her career learning to read power in rooms and knew exactly what had just happened. Mercer's recognition had been personal. This was institutional. Whatever Avery Bennett was to the world beyond Peninsula Memorial, she had not merely survived it. She was still attached to it. Avery met Reed's gaze and gave one short nod. The patient is ready for transfer, she said. Temporary control is holding. He needs definitive surgical access within the half hour. No acknowledgement of the statement beyond function. No gratitude. No discomfort. It was as if Reed had commented on the weather and she had replied with the only operationally relevant fact. Reed accepted that with the slightest movement at the corner of his mouth. So noted. He turned to Hannah. Doctor, my thanks. Hannah had no idea what version of gratitude one offered men like this, so she used the only language that felt honest. Keep the line intact and put him in an operating room fast. Reed's eyes held hers. That is the intention. Hannah almost said intention is not enough, but stopped herself. He already knew. Mercer had gone very still again, but this stillness was different from the one that accompanied entry. Now his attention kept returning to Avery with something close to professional respect, and something else beneath it that might have been relief. You look healthy, he said at last, the words so plain they were almost absurd in this room. Avery adjusted Logan's blanket over the warming pack. That disappoints you. It unsettles me. Good. That nearly drew a real smile from Mercer this time, but it disappeared before it fully formed. The lead flight medic spoke from the foot of the bed. We need to move in 60 seconds. Immediately, the room reassembled around motion. Portable oxygen switched over. Monitor detached from the wall and secured to transport power. Bloodline checked and looped. Catheter position confirmed again. Denise called out corridor clearance. Nate handed the chart packet to the flight medic, and then took it back when she asked for the access times verbally, his fingers not as steady as he wanted them to be. Avery stepped through the transport sequence without a single wasted word. Lead under the blanket will catch. Move it now. The medic moved it. Keep the line away from the rail latch. Mercer shifted the clamp point before anyone else saw the problem. Do not tilt his left side lower during the turn. The team nodded. Mercer looked at her. Still giving orders. Avery's hands were on the gurney lock, still useful. The transport team rolled the bed, half a foot stopped, rechecked the line, then prepared for the full move. Logan groaned as motion pulled at injury and tape, and the new architecture keeping him alive. Avery leaned in close enough that only he could hear. Stay with the noise. Do not fight the motion. He looked at her dazed and frightened, and trying very hard to remain a person inside all this machinery. Who are you? The question drifted into the small space between them and stayed there. Avery's expression did not change. The nurse getting you out of here. For some reason, that answer steadied him. Maybe because it was small enough to trust. The gurney rolled fully free of the trauma bay. All at once, the shape of the room changed. The bed that had anchored every movement for the last stretch of time was now in motion, drawing the entire emergency department into its orbit. As people stepped aside, doors pushed wider, equipment lifted clear of the path. The hall lights seemed harsher out there. The rotor sound stronger. Wind snaked through the seams around the ambulance doors each time they opened and closed. Staff from the outer stations turned to look. Some saw only a critical patient being moved under extraordinary conditions. Some saw the Navy flight gear. Some saw the man in the dark coat. Most of them saw Avery Bennett walking beside the gurney with one hand fixed near the line, and understood, without yet knowing why, that the center of the night had always been where she stood. As they reached the corridor toward the ambulance entrance, Reed slowed briefly beside Mercer. "After Wheels Up, I want an update." Mercer answered, "Yes, sir." Denise heard it and filed it away with everything else the night had broken open. Nate was on the opposite side of the gurney, keeping the chart one hand near the rail and the other hovering because he still felt one mistake away from losing something he could not get back. He found himself looking at Avery again, at the set of her shoulders, at the total absence of strain in the way she moved inside crisis. Quietly, so only she could hear, he asked Atlas. Avery kept her eyes on Logan's line. "Do not trip over the oxygen tubing, Nate." He looked down instantly. The tubing was about to catch under his shoe. Heat rose into his face as he corrected his step. Mercer, hearing it, gave a low sound that might have been amusement or approval or both. "Heal up your pride later, Doctor." Nate exhaled once, noted. The ambulance doors opened. Cold night air rushed the corridor, carrying rain fuel, sea salt, and the vast, hard beating of rotor blades into the hospital. For a moment, everyone had to narrow their eyes against the light and wind. The helicopter sat on the pad beyond a dark shape, crouched under spinning blades, navigation lights cutting through rain in sharp pulses of red and white. Ground crew hunched into the wash, signaling with illuminated wands. The world outside no longer looked like Port Angeles. It looked like an extraction point. Logan's eyes squeezed shut against the noise. Avery put one hand over the side of his face to steady his head, while the team paused at the threshold for final check. "Eyes open," she said. He forced them open. "There." The lead flight medic checked the line again. "Good." Hannah stepped as close as she could without entering the worst of the rotor wash, and gave the final physician handoff directly to the transport physician waiting just beyond the doors. Her voice had to cut through wind now hard and efficient. Temporary occlusion holding. Pressure last read 83/49. Ongoing transfusion. Left chest decompressed. Suspected abdominal source from blunt trauma. Time matters more than paperwork. The transport physician nodded, received. Reed remained just inside the doorway, dry under the overhang coat, stirring lightly in the displaced air. He watched Avery for one moment longer, and then said, not loudly, but with unmistakable clarity, "Ms. Bennett." She turned her head slightly. "Your judgment is noted." Avery's answer was immediate. "The patient is the point." Reed regarded her with an expression so subtle none of the civilians present could fully read it. "Yes," he said, "it usually is." There was history in that line. Enough to feel, not enough to decode. The gurney began moving again toward the helicopter, and Mercer took position beside the head while the flight medics managed the rest. For 2 steps, Avery stayed with them, one hand still on the rail until the lead medic said, "We have him." Avery let go. The absence of her hand from the rail seemed to change the night more than the arrival of the aircraft had. Logan turned his head weakly toward her as the bed rolled away through rain and light and sound. For 1 second it looked as if he wanted to ask again who she was. Then the wind took the moment and carried it elsewhere. Avery stood in the doorway, scrub top, tugged by the rotor wash hairline damp with blown rain, face unreadable in the wash of landing lights. Mercer glanced back once from the moving bed and lifted 2 fingers in the smallest possible sign of acknowledgement. She answered with a single nod. The helicopter swallowed the rest. Behind her, inside the emergency department, no one spoke for several breaths. Not because there was nothing to say. Because too much of what had just happened belonged to categories they had not been using an hour ago. Nurse, rookie, new hire, quiet, competent. All still true, perhaps. All now uselessly small. Denise was the first to find language. She looked at Avery's profile against the light from the pad and said very softly, "Who did we hire?" Avery did not turn around. "The same nurse you hired this afternoon." Denise almost laughed at the impossible economy of the answer. Behind them, the rotor noise continued to pound the night while the transfer team secured Logan for flight. Reed stood with his hands in the pockets of his coat posture, composed as if the sight of a storm-bound helicopter lifting a man held together by civilian improvisation and battlefield medicine was not especially unusual. Hannah came to stand on Avery's other side. "You could have told me," she said. Avery kept watching the aircraft. "You did not need my history to hear my clinical judgment." "No," Hannah said. "I needed your judgment. I had that." Avery said nothing. The distinction remained between them clean and respected. Inside the hall behind them, the ordinary hospital continued making its own small sounds. Phones, wheels, distant voices. A child coughing somewhere far enough away to feel like another life. But at the threshold of the ambulance bay under rain and rotor wash and the hard white glare of transport lights, the center of gravity stayed fixed on Avery Bennett, and the world that had just stepped through the doors to claim her without claiming her at all. Reed moved closer, stopping an appropriate distance away. "The receiving team will send status on arrival." Hannah nodded. "Good." Reed looked at Avery. "You are available if needed." It was not phrased as an order. Avery answered with the same level tone she had used for bloodlines and airways all night. "I am on shift until 0700. Reed accepted that, understood. Denise turned her head sharply enough to catch both of them in the corner of her eye. "Available if needed. On shift until 0700. The shape of their exchange made her skin prickle. Not because it was threatening, because it was too normal between them. Mercer reappeared at the helicopter door, rain running from his sleeves as he shouted something to the crew inside. A moment later, he jumped down and jogged back through the wash toward the entrance while the final straps were secured. He reached the overhang, breathing hard, but not winded, carrying the charged stillness of someone whose body had learned, long ago, how to exist inside noise. He stopped in front of Avery. "Line looks good. Keep it that way." "We intend to." A pause settled between them, visible in neither face, and present in every person watching. Mercer glanced toward Reed, then back to Avery. "You ever think of calling? Number? That figures. Did you miss me?" Mercer considered that with a face too disciplined to reveal much. "I missed the outcomes." For the first time all night, something almost human and almost warm passed through Avery's expression. Gone in an instant, but there. "That is close enough." Mercer nodded once. Agreement. The helicopter crew signaled from the pad. Reed stepped back under the overhang. Mercer turned to go, then stopped and looked at Hannah. "She gave you a man you can still save." Hannah met his eyes. "Then take him somewhere worthy of the effort." Mercer's gaze shifted to Avery one last time. Still carrying Mountain's atlas, Avery's eyes stayed on the helicopter. Only the ones people leave lying around. Then he was gone again, swallowed by rain and light and motion. The aircraft rose a few inches, settled, then lifted cleanly into the storm nose, turning over the blackness beyond the harbor. Its lights cut once through the rain curtain and then blurred into distance. The sound took longer to leave. It rolled over the roof, across the lot, over the water, and finally thinned into the dark until the emergency department could hear itself again. Only then did anyone around Avery fully realize how quiet she was once the work no longer required speech. She watched the place where the helicopter had vanished for one last second, then turned back toward the trauma bay with the same composed face she had worn before the call came in. No flourish, no release. No need to stand in the center of what had just happened and make it mean more than the patient. But for the people still standing there, it already meant more. The hall seemed smaller now, the fluorescent lights harsher, every familiar thing altered by the knowledge that it entered with rotor wash and left behind no useful explanation. Denise folded her arms tightly against the cold air pushing in through the doorway. Atlas, she said, as if testing how the word felt in her mouth. Avery walked past her toward the sink area, stripping off gloves one finger at a time. Do not start. Denise turned and followed her into the corridor. I am absolutely going to start. Nate was still holding the chart packet, though the patient it belonged to was already halfway to somewhere beyond his reach. He looked from Denise to Hannah to Avery, trying to figure out which question was least likely to make him sound foolish. He settled on none of them. Lily, on the other hand, whispered the one everyone had been thinking. She is military. Avery paused at the sink and washed her hands under water that came out too cold at first, and then warmer. Blood pinked the basin and disappeared. When she spoke, it was to the stream, not to anyone in particular. I am a nurse. It was not a denial. That made it more unsettling. Hannah stood in the doorway of the trauma bay and watched Avery dry her hands with a paper towel, fold it once, and drop it into the bin. The same movements she would have made after starting an IV or suturing a simple laceration. No visible difference between ordinary work and the night that had just split open around her. Reed remained near the ambulance entrance, speaking quietly into a phone no one had seen him remove from his coat. Denise looked at him, then back at Avery, and understood with sudden certainty that there were answers available in this building tonight, and none of them would be offered in the shape of curiosity. The emergency department had work left to do. Patients still waited. Labs still returned. Phones still rang. Yet every person who had stood in Trauma Bay 2 now carried the same awareness under the skin. They had not witnessed a hidden talent. They had witnessed a concealed life, one that had surfaced only because blood loss and time and weather had cornered it into the light. And Avery Bennett, still damp at the temples from blown rain, still in ordinary Navy scrubs, looked no more interested in explaining herself than she had been at midnight when the shift was just coffee charting and small emergencies no one remembered by dawn. The sound of the helicopter lingered longer than the aircraft itself. Even after the lights had disappeared into cloud and rain beyond the harbor, the emergency department still seemed to vibrate with its passing. Ceiling panels gave back a faint residual hum. The windows near the ambulance entrance rattled once, then settled. A sheet of transfer paperwork that had been lifted by rotor wash lay crumpled against the base of the wall, damp at one corner from blown rain. For a moment, nobody moved with purpose, not because there was nothing left to do, because everyone in the corridor was still adjusting to the sudden emptiness left behind when crisis took its center with it. Then Denise Walker exhaled through her nose and put the hospital back on its feet. "All right," she said, voice firm, level, unmistakably charge nurse again. Trauma bay reset, hallway mop. Somebody check on the chest pain in 6 before he decides neglect is part of the treatment plan. The spell broke. Lily turned first, then the tech, then Nate. Each of them pulled back toward the ordinary machinery of the department. A supply cart squeaked into motion. A door shut farther down the hall. A monitor alarm began sounding from another room, shrill and mundane and almost insulting after the last hour. Avery Bennett dried her hands and walked back toward Trauma Bay 2. No one stopped her. No one knew how. The room looked smaller now that Logan Pike was gone. Smaller and messier and more honest. Blood stained a folded towel left near the rail. Torn packaging littered the counter. Used syringes waited in the sharps container. A coil of tubing hung off the edge of the cart where someone had set it down half a second too fast. The overhead light still shone with the hard white glare of emergency, revealing the aftermath no one ever saw in the stories that only remembered the save. Avery reached up and switched the brightest arm down by one setting. The room softened by degrees. Nate was the one who followed her in. He still held himself too tight, adrenaline, not yet fully burned off chart packet, tucked under one arm, though there was nothing left to add to it. He stood just inside the doorway as if uncertain whether he was entering a room or crossing back into a life that made more sense than the one he had occupied 5 minutes earlier. Avery gathered wrappers from the counter and dropped them into the bin. Nate watched her for a second too long before he spoke. "Do you always clean the room yourself after that?" She picked up a discarded pressure bag and coiled the line before answering. "I clean the room that I worked in." "That is not what I meant." "No," she said, "it usually is not." He gave a short breath that might have become a laugh on a less exhausted face. "You could try making things easier once in a while." Avery set the coiled line into the supply basin and looked at the tray where the sheath packaging still lay open. "Would that help your charting?" He glanced down at the papers in his hand and admitted no. Then probably not. He stood there another second, then finally stepped toward the counter and began helping without asking which items were waste and which needed restocking. He had paid enough attention tonight to know the difference now. In the doorway, Hannah Price appeared with her scrub top darkened at the sleeves, where rain had found her under the overhang. She had the tired look of a physician who had held too many calculations in her head for too long, and was only now allowing her body to understand it. She took in the room, the wrappers Nate trying not to look rattled. Avery resetting a tray with infuriating calm. The receiving surgeon confirmed wheels down at Bremerton, she said. Nate looked up immediately. He made it. "They have him," Hannah replied. "They took him straight in." No one said anything to that at first. It was not triumph. It was not relief, exactly. In emergency medicine, the best outcome often arrived in pieces, and one patient reaching the next room still left a long distance between him and safe. But the sentence mattered. It meant the narrow bridge they had built in this modest trauma bay had held long enough for other hands to take over. Avery wiped down the rail where blood had dried at the edge of the mattress seal. "Good." That was all she said. Hannah leaned one shoulder against the doorframe and studied her with the unapologetic directness of someone no longer pretending she had not noticed what everyone else had noticed. "You knew the military transport process too well for this to have been luck." Avery changed the disinfectant wipe, folding the used one inward before dropping it into the red bag. "I know transfer logistics." "That is not what I said." Avery moved to the monitor leads. In the silence that followed, Nate pretended to sort wrappers by category so badly that Hannah almost told him to stop pretending. Instead, she said Atlas. The name sat in the room differently here. Less like a shock now. Heavier, more private. Avery untangled one of the leads before answering. "That was a long time ago." "Not that long," Hannah said. Avery glanced at her then, and for the first time since Logan arrived, there was something in her face that looked almost like weariness. "Long enough." Hannah accepted the answer not because it was satisfying, but because pressing harder in that tone would have been about curiosity rather than medicine. And however many questions had entered the department with the rotor wash, the patient had already taken the most important one with him. Denise stepped into the doorway with a fresh stack of linen. "His brother is here." The room went still in a different way. Nate lowered the chart. Hannah straightened. Avery set the monitor leads down on the counter. "Where is he?" Hannah asked. "Family consult room," Denise said. "Harbor office drove him. He made it just after the bird lifted." A pause. Then Denise looked directly at Avery. "He wants to know who he should thank." Avery's eyes returned to the bed. "The surgeon who takes him the rest of the way." Denise stood with the linen in her arms and gave her a long, tired look. That was not the question. Avery did not answer. Hannah stepped away from the doorframe. "I will talk to him." "So will I," Denise said, then looked once more at Avery and added, "You are still going to have to face people in this hospital tomorrow." Avery adjusted the trauma scissors back into their slot. "I was planning on it." Denise nearly smiled despite herself. "Of course you were." She and Hannah left together, their footsteps receding down the hall toward a man who had arrived too late to see his brother alive under those lights and would now have to build his understanding from fragments handed to him by strangers. Nate stayed where he was. "You really are just going to keep working." Avery looked at the trash bin, judged it too full, tied it off, and set a new liner in place. "Yes." He watched her a little longer and then said what had been needling at him since Mercer spoke in the trauma bay. When you said you had assisted that procedure, that was technically true. Yes, but it was also a lie by omission. She pulled open the supply drawer and counted fresh syringes into place. It was the amount of truth this room required at the time. Nate let that sit. Outside the bay, a child began crying in a high exhausted pattern from one of the exam rooms. Somewhere else, a printer restarted. Lily's voice drifted from the station as she answered a lab callback and tried very hard to sound less shaken than she still was. Nate rubbed a hand over his face. "I thought I wanted county trauma after residency," he said quietly. "Tonight, I am not sure I even know what trauma is." Avery looked at him for a second, not unkindly. Tonight was trauma. He gave a tired laugh. "I mean the real thing. This was the real thing. No, I mean the version you know." That landed. Not because the question was wrong. Because it was too honest to dismiss. Avery closed the supply drawer. "There are many versions," she said. "Most of them smell bad and arrive early." Nate shook his head. "That is a terrible answer. It is also true." He almost pushed further, then stopped. Something in her posture told him she was already giving him more than she intended to. Not in facts, in shape, in tone, in the way she chose each word as if it had weight. He looked around the room and saw it all differently now. The placement of the clamps, the order of the tray, the way the field had been built not for textbook neatness but for reach under pressure. He understood suddenly that he had been standing beside a person who had not merely learned advanced emergency skill. She had been shaped by circumstances where those skills had been used often enough to become instinct. Lily appeared at the doorway, breath a little quick from hurrying. Chest pain in 6 is asking if the helicopter was for him. Nate closed his eyes briefly. Avery picked up the clean sheet from Denise's stack and snapped it open over the trauma bed. "Tell him his EKG is not that exciting." Lily gave a startled half-laugh, then sobered. The laughter had been easy earlier in the night. Casual, social. Now it came with a different feeling around it, as though all of them were speaking in a room whose walls had shifted 1 inch to the left. She lingered. "Avery." "Yes." Lily swallowed. "Were you scared?" The question was so naked that neither Nate nor Avery answered immediately. Lily looked down. "Sorry, that sounded stupid." "No," Avery said. "It did not." Lily waited. Avery smoothed the sheet over the mattress and pulled the corners tight. "Yes," she said at last. Lily blinked. "You were—" "Yes." Nate looked up from the chart in spite of himself. Avery tucked the final corner into place before she continued. "Fear is not the problem. Delay." He says. Lily stood very still, taking that in. It did not answer everything. It answered enough. By the time Trauma Bay 2 was reset, the emergency department had found its rhythm again. Not the old rhythm exactly. A modified version. One with a new awareness moving beneath it like a current under visible water. The chest pain patient in 6 was discharged with instructions and an offended expression. The child with the cough finally accepted a nebulizer and fell asleep against his mother's shoulder. The drunk in hallway 2 made good on one of Avery's predictions and vomited neatly into the bag she had left him. A woman with a migraine cried from relief rather than pain when the medication finally worked. The weather report continued to crawl silently along the television screen in the waiting room, and through all of it Avery worked. She charted Logan's case in concise, exact language, entering each timestamp with the same neutral concentration she had given to every line and pressure reading. She helped Lily restart a failed IV in Bay 3 without mentioning that Lily's hands were shaking. She checked the crash cart, replaced 2 missing syringes, relabeled a drawer someone had restocked carelessly, then moved on before anyone could turn gratitude into conversation. At 3:20, Denise found her at the medication station. The hallway light there was dimmer than the trauma bays, warm enough to make the edges of fatigue visible on both their faces. Denise set down a paper cup of fresh coffee beside Avery's charting hand. "You are drinking something that is not protein shake or silence." Avery looked at the cup. "That sounds expensive." "It is free. Drink it." Avery took the cup and tested the heat. Denise leaned against the counter and crossed her arms. She no longer looked curious. She looked protective in the way charge nurses did when a unit had been through something together, and one person in it was pretending not to have. I told Logan's brother that the team here kept him alive long enough for surgery. Avery nodded once. That is accurate. He asked if the nurse with him on the way out was family. That pulled the smallest change from Avery's face. Not quite surprise. More like recognition of a possibility she had not considered. "What did you say?" I said no. Denise watched her closely. Then he asked why you talked to his brother like you already knew how to keep him from quitting. Avery looked down at the coffee. "And," I said, "some nurses know how to hold a room together when it starts to come apart." That earned her a glance. "You made that sound generous." Denise shrugged. It was the truth. Avery took one drink of the coffee. It was too hot and a little burnt and entirely welcome. Denise let the silence stretch before asking the only version of the question that still felt fair. "Are you staying?" Avery frowned faintly. "Tonight? At this hospital." Avery set the cup down. "Yes." Denise studied her for another beat and then nodded as if filing away something vital. "Good. No more questions." Not because Denise had run out of them. Because she had finally chosen which one mattered. At 4:10, Hannah returned from checking on the OR case downstairs and found Avery finishing the chart. "The receiving facility called back," she said quietly. "They are in surgery." Avery did not look up from the screen right away. She completed the line she was typing, then saved the entry. "Status: alive on arrival. Pressure held through transfer. They had abdominal surgeons waiting." Avery leaned back slightly from the keyboard. That was all. No visible relief, no release. Yet Hannah saw the small shift in her shoulders, the way tension redistributed rather than vanished. "You can let that one sit now," Hannah said. Avery closed the chart. "I know." Hannah remained standing beside the station. For a few seconds, neither of them spoke. Around them, the emergency department continued its smaller emergencies with the humble persistence that made medicine feel both endless and worth doing. Finally, Hannah said, "You saved him." Avery looked at her. "We kept him alive." Hannah held her gaze. "You know what I mean." "Yes," Avery said, "I do." She picked up the coffee again. Hannah almost smiled. "That is the closest thing to graciousness I'm going to get from you, is it not?" "Yes." This time Hannah did smile. By 5:30, the storm had begun to thin over the harbor. Not gone, just less absolute. Rain eased from pounding sheets to steady lines against the glass. The black at the edge of the windows softened by barely perceptible degrees. Night shift developed that particular fatigue of the hour before dawn, when the body knew it had been awake too long and the mind ran on discipline alone. Denise sent Lily to sit down for 7 minutes and made Nate drink water again when his hands started moving too fast through discharge paperwork. The lab courier arrived looking miserable and drenched. Environmental Services mopped the corridor outside Trauma Bay 2 with the unbothered expression of people who had seen worse and trusted hospitals to go right on needing clean floors no matter what stories had just happened on them. Avery helped turn over Bay 4 restocked gauze, checked a child's temperature, and never once referred to the helicopter Mercer Atlas read or anything else the night had dragged into view. By then, no one expected her to. The change in the department showed itself in smaller ways. Lily no longer double-checked every order Avery touched. Nate asked for her read on a patient before asking out of habit whether he should repeat a blood pressure. A respiratory therapist handed her a setup with the quiet assumption that she would notice if something in it was wrong. When a family member grew panicked in the waiting room, Denise called Avery with the tone people used for someone they trusted to steady turbulence. No ceremony, no declaration, just altered orbit. At 6:12, the first real color of morning entered the hospital windows. Cold gray at first, then the faintest blue-silver over the harbor beyond the lot. The emergency department looked less dramatic in dawn light and more exposed. Counters showed scratches. Chairs looked harder. Faces looked more tired. The fluorescent world of night gave way to the unflattering honesty of day. Shift change began arriving in small clusters. Fresh scrubs, damp hair. Coffee cups. The day charge nurse stopped mid-step when she felt the unusual density in the room and knew before anyone said it that something had happened in the dark hours she would spend the next week hearing retold in fragments. Avery gave handoff on her patients with the same precise calm she had used at 1 in the morning before any of this began. Pneumonia in 4. Improving after reposition and treatment. Pediatric cough in 3. Good response after neb. Recheck before discharge. Migraine in 7. Symptoms controlled. Await ride home. She delivered each summary in clear, restrained language, no extra flourish, no fatigue in her voice that she allowed to become anyone else's problem. When she reached the trauma case, the station around her seemed to quiet without trying. Logan Pike, 34, blunt maritime trauma. Positive fast. Profound hypotension secondary to suspected abdominal hemorrhage. Temporary aortic occlusion placed for transfer after OR unavailable and civilian air grounded. Naval transport assumed care at 0304. Receiving facility confirmed operative intake. The incoming nurse stared for a second. "You what?" Denise, standing nearby with her own handoff sheet, answered without looking up. "She means read the note." A couple of people laughed softly. The tension broke. The day nurse blinked twice and then did exactly what she had been told. Avery finished the rest of report, signed what needed signing, and clipped her pen back into place. There was no applause, no crowd, no speech waiting for her at the end of the station. Only work completed and handed over. As the day shift absorbed the floor, Hannah crossed to Avery near the lockers. "You are off in 10 minutes. Avery nodded. "Go home," Hannah said. "Yes." Hannah hesitated, then added, "If anyone from administration tries to turn tonight into something decorative, send them to me." Avery's mouth shifted at one corner. "That sounds threatening." "It is." For a moment, they stood there in the quiet space between exhaustion and departure physician and nurse, both aware that some form of respect had settled between them more durable than gratitude. Then Hannah said, "I am glad you are here." Avery held her gaze and answered with complete seriousness, "So am I." When Hannah walked away, Denise stepped in almost immediately, as if they had planned the timing without speaking. She held out Avery's folded jacket, the one that had been left untouched on the break room chair all night. "You forgot this." "I did not forget it," Avery said. Denise lifted an eyebrow. "You planning to walk home in scrub sleeves and mystery?" Avery took the jacket. "That was one option." Denise shook her head. "I have hired some strange people. You remain highly competitive." Avery slid one arm into the jacket and paused. "Thank you." Denise did not pretend not to understand what the thanks was for. For the coffee. For not asking the wrong questions. Denise's expression changed, softened by something older than humor. "I asked one important one." Avery looked at her. "Are you staying?" Denise said. Avery finished putting on the jacket. "Yes." Denise nodded once, satisfied. "Good." Morning had fully taken the windows by then. Port Angeles emerged again from the storm-washed cold and gray and ordinary. Harbor cranes stood against the light. Water moved beyond the lot. Somewhere out there beyond cloud and distance and another set of operating room lights, Logan Pike was under the hands of surgeons with better access and more time than Peninsula Memorial had ever possessed in the night. Inside the hospital, carts rolled. Phones rang. Someone laughed at the front desk. Someone swore softly at a jammed printer. The world had resumed without asking whether anyone was ready. Avery Bennett picked up her bag and headed for the exit with the same measured pace she had carried through every corridor since midnight. People noticed her as she passed now, not because she wanted them to, because they could not help it. The rookie label had gone out of the room with the helicopter and had not come back. In its place was something quieter and much harder to misread. Not myth, not legend, just the solid recognition that some people arrived without fanfare, did the work when the floor gave way beneath everyone else, and returned the room to order before dawn had fully broken. At the double doors leading out toward the parking lot, Avery paused only long enough to look once toward the eastern sky over the harbor. Then she stepped into the cold morning, and disappeared into a city that, for all its wind and water and distance, looked as if it had no idea what had happened inside that hospital while it slept.